Yes, so C-section call. Accurate. Dr. Diggs is coming. Go in the room, make sure you have your hat, your mask on, and shoe covers if you want them. And then you go ahead and open the room. We'll have a gown on top, just grab that and hold it until you get the rest of it open. Grab it by the edges and pull it open. The extra gown, just grab it on the back side opposite of the fold, pull it open, and throw it up on top of the table. And just get everything else opened up. This over here is the text for us, whoever can be scrubbing in. And you open everything on your mayo trays out. You take them off the section table. Your towels, you just come and grab them from the side that you undo them from. Hold them and wrap them, and you take the whole bottom side, and then you just set them on the table. Then you'll have the gloves up here. You just pick your doctor's size and his assistant's size. And an extra V on. Okay, and you'll have some extra ones. You can just throw it at the bottom for the time being. Over here you have your light handle sitting on top of the instruments. You kind of hold them with your hand on the bottom, on the handle side. Open them up like this. Pull that back and you have it grasped in your hand, and they snap on. And over here on the instrument case, you'll have a little white tag that goes to the circulator, so you just pull that off and give it to the circulator. For this, you check to make sure the blue filter is in there and that the blue tags are locked on the side. And if everything's good, you go ahead and open it. You take the lid off. And then now your room is open for a section. Now we go outside and scrub. get whatever scrub you want. There's a little pick to clean under your fingernails if you have fingernails. And all of them. Some nails. There's your soap all up. And you go back and you do each individual finger.
I know you said he ordered, he said that I have to get it and make that he keeps them right prescription. And he said,
all the way to the elbow. And you go to the other hand.
yeah, he wants to have like 500 kilos.
Now it's time to rinse.
Did you find the number for that, Dr. Jenna?
Okay, keep your hands up. Turn your back to the door. Open it. We'll have a little white towel on the gown here. You just take that up, pick it up, open it, and dry off one arm at a time.
Will it be in the printed record?
You can air dry for a couple of seconds if you're a little bit wet still. Alrighty, come and you grab your gown towards the folded side, which is that side, not the open side. You put your hands in there, just open it up and let it fall. Be sure you don't touch anything. And you put your gloves on. Okay, you're ready to start the case to get your back table set up.
As soon as the circulator turns her up.
The circulator come tie you up so your gown isn't touching all over the table and you're not contaminating anything.
First you snap these, kind of stretch their arms out a little bit. Do not go past the shoulders, you'll contaminate them. Tie this back here. Kind of pull it down a little bit. And then take the card, right where the thumbprint is right there, no further than the blue. And hold on to it, and they'll grab it up here and you pull it.
All right, you find the mayo stand cover, which is going to be this one, and it has the two hands on it. That's where your hands go, up underneath there. gonna open it like that, and it opens up, and that's your mayo goes in there. You will have extra, just take it and tuck it under the tray. Let's just tray up some. Now, whatever doctors are helping, you get their gloves out. The left one goes on the bottom, the right one on the top. You get the gown. And then each one of them will get a towel. Okay, and if you have any more, then they just kind of stack up on top of each other. Any extra things you have, any extra gowns, you just put them in the back corner of the table. You have a trash bag that hangs on your mayo. Start working with everything you have here. Your pull section, this part just slides down onto it. I'm going to set it right there. Your Bovie pencil will have a clear plastic on it. You pull that off. Put in the trash right there. You'll have 4 blue towels. Those are just extra. They'll set up on the side. You have a suction. You just pull the little blue piece out of there. And your new suction tip. And then your drape will set on top of all that. And just stuff over. And you put 4 towels to drape with, and 1 towel to blot with the excess betadine solution on there. There will be a little baby blanket. You just hand that off to your circulator. And you have your laps, and there should be 5 in each pack, so you count them 1, 2, 3, 4, 5. One goes there. 1, 2, 3, 4, 5. And I'm just going to sit there. You will have an extra suction tubing in a suction that just goes on the bottom of your start kit. And in this blue bucket go your suction device and your 3 clamps and your test tube. An extra towel. And this one right here, you just take and roll it up. It kind of stabilizes the instruments on the mayo tray. Okay, you come back over here. This thing sits on this corner. You'll have 4x4s that go underneath. This red box has little sticky tapes. You just pull those off and it sticks to your table. The same thing with the insert. Just pull the back of it off. And it's sticky back here and it just sticks inside your little red box. And you have your other laps. There should be 5 there. 1, 2, 3, 4, 5. You just go onto your table. And you have a medicine cup. You'll have some stickies and a ruler. It just kind of sticks under your sharp spots and your marker. Just lays beside. And then you'll have a blade protector that goes on your mayo tray. And it just sticks on there as well. And then your blades. You'll have 3 blades in here. 2 10s and a 15. The 15 just goes underneath. And the 2 10s, you open them up on your tray. Just like that. And it's trash. Okay, and then you'll put your stapler kind of right there and your pairing pad right there. Then you'll put together your syringe and just lay it on your little sharp spots. And then your suture, just tear them open like so. Alrighty. The polysorb, you keep 2 out on this side and the rest get tucked under your towel. Just like that. And you're ready for your instruments now. So you just grab the inside handles, pull it straight up, and take it to your table. Alright, then you have your bladder on your Richardson retractor, your bladder blade. And then there's a bunch of loose stuff in here. And you just grab all of that except for the bandage scissors. These are your goulet retractors. Atsons, Ferris Smith, Russian, and then a smooth thumb. You put your blades on. You just hold it. Not like that, like that. Alrighty. Move back over here. You will need 4 Kellys and 1 Alice. Put those on your tray. Good. You have 3 scissors, 2 needle holders, and the long Oshner's. And you have your needles here. You can just load it. You grab your needle, like that. You just kind of adjust it on there. And that just sets up there like that. So you'll have one ready. And then you have your wing forceps. You put 2 long ones out and 1 short one. And the rest just go back into your tray. And that will be your tray. This is the setup. Just the crack of. Alrighty, so you've got your patient on the bed already. They have prepped the patient already. Oh, for a gamma doctor.
No count.
Oh, that's right. Count. Forget my father up here bigger than me. Alright, once you get everything all set up, then you have to make your count. So you start with your laps. You have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 11, 12, 13, 14, 15. And your extra little bag over here, you write it on there. So you have 15 laps. And then you will count your sharps. So you have 1, 2, and your needle on your bovie tip is a sharp, so that's 3. So you write it down. And then your needles on your mayo tray, you have 1, 2, 3, 4, 5. And then you count your instruments. You have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21. 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35. And this just gets sent off to the circulator without the needle on it. Alrighty. Now you're ready for your patient. Your patient is prepped already. You take your top towel, and a lot of times the betadine stands on there. So you just take it and lay it across them, pat it off, grab it, and go to the trash. And you get your towels, and you prep your patient. Just like that, you open them up, just put it down right there. And this one goes this way. Alrighty, and that way you have your area where you're gonna cut. You get your drape, and it has the sticky stuff on it, and you just pull the paper. That's over your trash. And you have a picture of a person on there, and that's the way the drape goes on. Just open it, press it down, and you spread it apart. In this part, the anesthesia is usually up here to grab the drape, and they'll pack it up. You can just pour down this little flap, pour your paper off of there. That goes to the trash. You just push it down, make sure you got most of the bubbles out of it, and your patient is ready. You pull these up so any fluid will get caught in the bag. Get your suction and your bovie. You just pull about an arm's length. You stick it in the side. And your bovie. It goes in the same hole with the suction. Arm's length. You just kind of loop it around. And that you can stick in there too. And then these two ends go off. And your circulator comes into control. You pull your tray up. There is a bucket down here. I mean a bucket. A latch. You can make it go up and down. Clear your patient's feet, so you just make sure that you got an arm's length under there on your patient. You pull your table up, and you're ready to go.
The end.
Okay, the doctor comes in all scrubbed. You take the towel, you just open it up, you throw it onto their hand like that, and then they dry off. And then once they're dry, they'll throw their towel on the ground or somewhere, not on the sterile film. Yeah.
Is it right?
But the doctor won't have jewelry on. If they do, you have to send them back out of the room to take it off. You can just open your gown up, kind of tuck your hands under, and put it on the doctor. And they'll put their arms up and you pull it just so their thumbs stick out a little bit. Then you get their gloves. The right one goes first. And you just hold it open like that. And you stick their hand in. And then they hold it with their right hand. And put their other one in there. And then the doctor's ready to be tied up and cut.